Change begins from within. As easy as it is to look outside of ourselves and want the world to change, the truth is, it never will if we remain the same. This podcast was created for changemakers like you who want more love and connection in your community. Today, you are going to hear stories that will inspire you and also challenge you to be the change. We are going to go deep, my friend. So take a deep breath and settle in. My name is Emilia Tamburini. Welcome to the Circle of Change. Hello, dear friend. I am grateful that you are here with us in Circle today. I am feeling a lightness that I haven't felt for a while now. And part of that lightness came from re-listening to this conversation that I had with Nancy Edwards. Nancy's stories reignited parts of me that I have left in the dark, including a fire for epidemiology, working internationally, and cross-cultural community change. This conversation on so many levels felt like coming home. I truly hope you enjoy this conversation as much as I do. I think you will, because not only is Nancy a beautiful storyteller, her wisdom can be applied to so many situations in our world right now. Nancy is a retired nurse and epidemiologist. She's a distinguished professor and professor emerita at the University of Ottawa. She has received numerous awards, including 3 honorary doctoral degrees. Nancy is passionate about global health and public health, and you will pick up on that in our conversation today. Her career has spanned 5 continents, with research in lower and middle income countries that focused on maternal and child health inequities, HIV and AIDS, and capacity building. And she has documented some of this journey in her memoir, Not One, Not Even One, a memoir of life-altering experiences in Sierra Leone, Africa, West Africa, which you can find in bookstores and libraries across the country. There are a few terms mentioned in this conversation that I've included references for in the show notes on the episode's webpage. She mentions the FLQ crisis. FLQ stands for Front de Libération du Québec, which was an extremist separatist group in Quebec in the 1960s. The history is actually quite fascinating, so I do recommend you go check it out. And the definition of epidemiology, which is the study of disease patterns and what determines disease in our populations. This is why this term became so well known during the COVID pandemic. If there are other terms that are mentioned and you would like them included, please let us know. This is our last guest episode for the fall 2022 season. I will be back with you next week to recap all of the teachings of this season. And I am delighted to end our guest shows on this note. This episode and conversation has given me so much to think about in terms of what I want to be up to in the world. For you as a change maker, the lessons that Nancy leaves us with are applicable to so many situations, whether it's trying to determine the best solution to a population problem, how to walk in 2 worlds, and we are doing that in the journey of reconciliation, or how to have a conversation with your grandchild. This conversation will really guide you toward the resolution. There are so many nuggets. I will come in at the end again to summarize some of these nuggets so you can easily take them and apply them to your own setting. Enjoy this conversation. Nancy, welcome to the Circle of Change. So great to have you here.
Wonderful to be here. I'm really looking forward to speaking with you.
Me too. I was so excited to be introduced to you for many reasons, but one is that we actually share some commonalities. So you are a retired nurse, and I grew up in a nursing family. So my mom is a retired nurse as well, but also my grandparents were both nurses. So I was brought up in that culture of nursing, mainly in a nursing home setting.
Oh, how interesting. There are a lot of nurses out there.
There are. And you're also an epidemiologist, as am I. And so I just have to think, and you can correct me if I'm wrong, but that you and I share this propensity of looking at the world with a lens of trying to understand, like, what is it that determines health and well-being? And yeah, would you say that's true for you?
Oh, absolutely. I think it came before my epidemiology training. So who knows? Maybe there's a gene for this as well. But at least now everybody can actually define the term epidemiology. This is one of the positive outcomes of the COVID pandemic.
That's right. I agree. Well, it's so great to have you here. And I'm really looking forward to our conversation and learning more about your very exciting life journey and the beautiful work that you've been doing, and diving more into what you share in your book, Not One, Not Even One, a memoir of life-altering experiences in Sierra Leone, West Africa.
A rather long title, don't you think?
It's a great title. Oh, it's descriptive, which, for me, it makes me very curious, especially the not one, not even one. Like, that's such a powerful start, and it makes me want to learn more. But we will get into that. In this moment, I want to settle us in to this present moment so you and I can be grounded and really connected in our circle. And so our listener, who is also sitting here with us in circle, can also center their energy in this moment. So if you want to close your eyes, feel free to do that, Nancy and the listener. And let's just take a deep breath in, big belly breath through our noses, and big exhale. And feel free to do that a couple more times, and maybe center yourself on gratitude. What is one thing you are grateful for in this moment? I am grateful that I have opportunities like this to hear stories of courageous change makers and bring those stories to you, our listener. And we're going to do something a little bit differently today because Nancy writes haiku poems. And so I'm actually going to read one of her poems to bring us into circle. And the poem that I've selected is called Awaiting Rain. Lush forest backdrops beckon against burnt, charred land, aspirations for planting. I love that.
I think it's great that you chose that one. Aspirations. It's such an important part of the kind of work that I was involved in. It has to be hopeful.
Yeah. And I was reading on your website this morning how you wrote these poems, like biking along the Ottawa River. Do you have a memory of when this particular haiku came to you?
Oh, I'm not sure that I do, because every bike ride seemed the same in a sense, because I was so focused on the poetry in my head. But it was exactly 10 kilometers to write one haiku poem in my mind. And I don't have a great memory, so it was short, sweet, and I could practice it, make sure I had the right number of syllables, and get it down on paper before I got home.
That's so amazing. I love it.
I do have strong memories, of course, of the many, many, many farms that I visited when I was in Sierra Leone.
Oh, beautiful. Well, let's start with having the listener get to know you a little bit more and really get to know your essence, which is why I love this question so much. And the question is, who are you? And this would also be the time, if you have a talking piece, to introduce it to the listener. So, Nancy, who are you?
It is a super question. And I think I will start by saying I'm a grandmother, because this is a relatively new role for me. My grandson, and I only have one, is 2.5 years old. And he's just teaching me so much about living in the moment, about the delights of the simplest things, whether it be a little rock that he picks up, or a stalk of grass, or the wind blowing, or the geese migrating overhead. It's all new to him, of course. but it brings a newness to me as well. You've already explained that, on the professional side, I'm a community health nurse and an epidemiologist. I sometimes describe myself as a recovering academic. I was in academia for a long time and did lots of academic writing, but writing a memoir was something quite different, much more about looking internally with your own reflections and speaking from the heart. And I would describe myself as an advocate for change, particularly for healthier communities. And that probably brings me to my talking piece. I actually chose a picture. So this is a photo of a mother and her twins. She's carrying one in front of her and one is strapped on her back with a lapa, which was a local piece of cloth. And she has a daughter and a son who are probably about 4 and 7 years old. And I met her in a very small village called Blama. And she kind of hung on the perimeter of my discussions with the chief for quite a while. It was obvious that she wanted to speak to myself and her public health team. And she was worried about her youngest twins because they were showing some signs of malnutrition, and one of them had gastroenteritis and so on. But I was just so inspired by her advocacy for her young ones. She was a mother with no literacy skills, but she was right in there, had stayed back from the farm and wanted to talk to us about what to do for her children. And this photo, which is now quite faded, actually sits on my bedside table, and it has for 30 years. And she's my inspiration every day when I get up about who can advocate for change and that it can involve all of us and that small voices really matter. So that's my talking piece.
And such a powerful message that each and every one of us can be a change maker. And I think all that it requires is a choice to claim that for yourself.
Yes, and having a level of confidence that your voice matters. And in her case, that didn't come from any formal education, but it came from the support of her community, her own strong feelings of love for her children, and wanting to do the best for them in a small village, which might as well be in the back of beyond, where sustainable farming was the only way in which people could earn a living, but they did it with great dignity.
Thanks for sharing that story. It's a beautiful way to begin. It makes me curious about more of your life journey. So you have chosen to take your nursing and your experience to many countries around the world and be of service there. And one of those, of course, was Sierra Leone. So can you share with us a little bit more about your journey and what it was that pulled you to Sierra Leone eventually?
So I grew up in Montreal in the 50s and the 60s. This was at the time of the war in Vietnam, as well as the FLQ crisis. But I remember seeing TV images, no internet then, of children who were killed or maimed and suffering, as were their families, of course, in that war. And this sense of unfairness and injustice just was overwhelming for me. And I'm sure that came from, what my parents had instilled in me as a youngster. But I decided then and there that actually what I wanted to do when I grew up was to be a physiotherapist and help these children who had been maimed. I thought I wanted to work overseas. Anyhow, life, sometimes takes us on a slightly different path. And I ended up studying nursing at the University of Windsor rather than physiotherapy. And thank goodness, because I think that was actually the right route for me. But I also, in the 60s, was 15 years old when Expo 67 was on. And that was just like this window that opened up to this world of cultural diversity. And I just wanted to be in with some of those experiences. So that was kind of the travel side of me and the curiosity side of me, I guess. So putting those two things together, when I was studying for nursing, CUSO, which then stood for Canadian University Services Overseas, now CUSO International, came knocking. and did a presentation for us. And I just remember I was hooked. I was going to join CUSO as soon as I finished university. And then when I finished university, I learned that you had to have 2 years of clinical experience in order to go overseas, which I thought was kind of crazy, but thank goodness. So I headed off to work in Vancouver for a while as a staff nurse. And then I actually went to Australia and taught nursing in Townsville, Australia, to see if I liked nursing education and to see how I managed living in the tropics. And I traveled for about 8 months through many lower middle income countries. And I came back to Canada, having sent my application to CUSO in before I left Australia, only to learn that the application never made it to the CUSO office. So I was back at square one. And then I got a job in Bayvert, Newfoundland, working in the outports as a community health nurse. And of all the places in Canada where you would not expect to meet people who lived in Africa, there were many people at this United Church Hospital who had worked in Angola actually as missionaries and had been ousted because of the Civil War. And so I was in the midst of many professional colleagues who had worked in parts of Africa, Angola and Malawi primarily. So I reapplied to CUSO and was given 5 countries to choose from, 5 placements. Sierra Leone was one of them. It was the only job that involved community health and teaching, and I wanted the combination. So that's how I chose Sierra Leone, or Sierra Leone chose me, I guess, and ended up there.
Wow. What a cool story. What came to me as you were sharing was your ability to go with the flow. Like, although maybe you had ideas about your path and the direction it needed to go and when, it's like, well, the universe had a different route for you to get there and took you to a place that maybe was not even on the map originally, but then has led to such a rich and beautiful life experience.
Yes, I think adaptability is important, but I have my moments of stubbornness too. Just to be upfront.
Yeah, you're human. It's okay.
Oh, absolutely.
Oh, how wonderful. Our podcast here is for change makers. I feel like as change makers, we're often in situations where we're an outsider and attempting to make change. And it feels like that has been your life experience in the work that you've done, especially internationally. Can you share with us a little bit about what that experience was like for you? Like, to arrive in a country and obviously having these intentions of supporting and improving health and well-being, but doing that in a culture that was not your own. How did you find resolution in that journey?
Yes, it's interesting to know how I would have described it at that time and how I describe it now with hindsight. But what I remember about it is that when I went, I think I was pretty altruistic. And you have captured it nicely in your introduction to this question about, wanting to be a change agent. That was why I went. But I think I was really struck initially by what a steep learning curve it was to now be fully immersed in the Mende culture. I worked primarily with the Mende ethnic group. I was in a very, very rural area, only 150 miles or so from the capital, Freetown, but nevertheless remote in every other way. And I can recall at 6 months into the journey thinking that when I had arrived, I knew nothing. And at 6 months, I was still on a steep learning trajectory. And every day brought new learning, which was fun and fascinating, but also intimidating at times because, you can do harm as an agent of change. It's not all about good stuff. But I had great mentors, particularly my Sierra Leonean colleagues, and some of whom had extensive community health experience, some of them with the students with lots of life experience, and an Irish sister who had been at the hospital for many years, Sister Hilary Lyons, who I speak about in the book in a few places, who was a wonderful mentor for me. But there's 2 examples I want to use, and really, I think they help to illustrate, what you can change, and also the dimension of what you should or should not change as somebody who is a cultural outsider. And always you remain a cultural outsider. I'm not a Mende woman. So the first example happened early on in my experiences there. And we were in Sierra Leone when they rolled out the expanded program of immunization, which was bringing basic childhood immunization to kids, as well as tetanus toxoid immunization to pregnant women. And it was very exciting. And there was a lot of support in the villages for this because they had seen the results of smallpox eradication. So the elders were very much in support of the immunization program. And the students were well versed in, what kind of health education to provide to the women when they went to immunize them. But what I kept hearing them say, and my Mende wasn't very good, was they used the word germcy. And in the Mende language, whenever there was not a Mende word for an object or a practice, they would take the English word and add C on the end. So window C was another example because people didn't have glass windows in their homes. Guitar C was another example. Germ C was how the students were trying to explain why the children needed to be immunized. And I paused and asked them, well, what did the women believe about what caused the disease? And it was enlightening. The women thought, as did all villagers, that measles was caused by a witch spraying hot water on a child at night, which of course caused the red rash. They thought that polio was caused by a boa constrictor partially swallowing a child at night, creating the maiming and disability. And I just thought, immunization is not about making sure people can use the right words and getting them to come over to this, my view of the world, which is that a germ causes disease. Let's go with their explanation. And so we changed our health education. Germ C was no longer included. And it was about the immunization would help to protect the child, to fight the witch at night, so it wouldn't spray the hot water on the child and so on. So that is my first example. My second example relates to neonatal tetanus. We had some of the highest rates of neonatal tetanus in the world when I lived there. It's a horrible, horrible disease that almost always kills newborns when they get it. And it was caused because the women who did almost all the deliveries at home, the traditional birth attendants, would store a bamboo sliver or sometimes a razor blade in the mud wall of their huts so that they knew where it was and could take it down when they were going to do a delivery to cut the umbilical cord. And in cutting the cord, of course, they were actually introducing tetanus spores into the cord, and babies would sometimes come down with the disease. So we were immunizing against tetanus and having some success in every chief we talked to, every health education session, every clinic, every traditional birth attendant we talked to, and so on. This was part of what we discussed. But there was something still missing. It was our problem, not quite theirs. It was their problem, but it wasn't their solution yet. They didn't fully embrace it. So how to get them to become the agents of change. So what happened over time was that the traditional birth attendants finally came to us and said, we want to make tetanus toxoid immunization part of the initiation ceremonies for young women, young teens becoming adults. It was theirs, and they were going to spread the word within the Bundu Secret Society to other traditional birth attendants. They had become the agents of change. That was such a pivotal moment. I'll never forget it. Very exciting.
There are so many nuggets in the stories you shared, and you're a beautiful storyteller, Nancy. I so appreciate this. The things that stuck out for me were what was effective was adopting the worldview of where you were instead of trying to force people to look at the world through your lens. In that, there's a letting go of my worldview is right and your worldview is wrong. And what it came down to was like, how can we improve the health and well-being in the most effective, powerful way? And that has nothing to do with me and my knowledge and my training and how I understand this. This is how do we communicate in a way that this wisdom can be adopted and taken as their own, which I don't know, that is so powerful.
I think it's finding that intersection between two worldviews because I can never fully adopt somebody else's worldview. It's not mine. As they say in Newfoundland, you always come from away. No matter how long I would have lived in Newfoundland, I was still a mainlander, not somebody from there. And the same in Sierra Leone. But it's being open, as you were also suggesting, to other worldviews and other ways of seeing things, and not immediately discounting those as not as wise, not as good, not as important as the perspective you come from. So finding that sweet spot somewhere in between that allows you to move forward.
Yes, which requires observation and like a stillness, which I'm really picking up in you and is a skill of yours, is being able to pay attention to what's not being said, or maybe what's being said on the sidelines that people are just kind of running past, but taking that pause and actually doing that, and then allowing solutions to really to come from the community in many ways, so that they become agents of change. And it's not about you.
Yes, and I think there's an element of trust as well. We often talk about whether or not the community trusts professionals, and that is important. The flip side of that coin, which is the professionals trusting the community and trusting their wisdom and their know-how and their intimate knowledge of the community, which somebody who's from outside the community, even somebody who lives in Ottawa, to understand how a Torontonian sees things, or somebody in Haida Gwaii, I can't fully. It's that mutual trust that's really important. And as you say, sometimes the silence it's what's not said. It's listening as deeply as you can to what is said. That's so important to get there.
You're speaking of trust building, and I know part of the work and how you were with communities was actually sitting in circle. I know we talked about a little bit about that in a prior conversation. And that that's near and dear to my heart as well, this way of being. And I also know from our conversation that community connectedness is really important to you. And so I'm not sure if circle work is related to that for you and this building of trust, but in your opinion, like, why is community connectedness so important? Or what is it about it that is important?
Well, I think it's so important to experience and feel and to understand. Among the Mende people, they had an expression which literally translated means hanging heads, which was really, they didn't call it a circle, but it was a circle. It was a way of coming together and hearing each other and trying to find a solution to a problem, or trying to navigate out of a challenge that the community was experiencing. There were many examples of hanging heads with traditional birth attendants sitting with the village health committees that we were training, hearing their perspectives on why things were difficult, or what was working and what was not, and what they thought was a priority for change, what they felt was realistic to change. And I think out of that, I learned a lot. Some of it was learning about community connectedness. I remember one particular village we worked in, and it was a challenging village to work in because they had a lot of people who came seasonally to that village from other parts of Sierra Leone, and they were also of another ethnic group, which meant that they didn't have the language necessarily, and so on. But it was a diamond mining village. They were looking for alluvial diamonds, and the houses would be bulging with people. They'd actually have to sleep in shifts and so on to accommodate all of these seasonal workers. And I just remember the chief talking about his perspective of it being a difficult village to work in because of the lack of community connectedness and this disruption to community connectedness that happened regularly. And he was asking us to be patient with them because their way forward was not the same as another village where they didn't have this a seasonal workforce coming in. And I also recall learning a lot about ancestors as part of that community connectedness. I mean, I've always loved working with older people, and I have a lot of respect for elders and elders' wisdom and so on. But ancestors, like these were spirits I couldn't see or feel. They weren't my ancestors, but there were many instances when the role of the ancestors came up and how important they were. And the spirit of the ancestors were believed to reside around the traditional water sources, which were usually the local river or stream, a lifeline for people. Of course, they had to have water. Sometimes when a new well was dug, especially one that was dug with no consultation, no hanging heads with the Mende elders, they would choose hydrologically the best place to put it, but it was often far from the stream and the ancestors weren't consulted. So often people would choose not to use it if the ancestors had not been consulted because they didn't want to make the ancestors angry. And an angry ancestor is a bad thing. They can bring social ill to that community. And so I learned that layer of spirituality and so on is so important to understand. And that was a big part of what community connectedness meant. So dimensions of it that I had no appreciation of before certainly came to the fore during my work in the villages.
Yeah, I can relate to all of that in my work with Indigenous community here in North America and really and in oil and gas and mining industries and listening to these stories of ancestors and incorporating that traditional knowledge into very Western ways of thinking about the world. And certainly I think there's more of an opening now in our Western society to really listen to that. But I imagine in the era that you were doing this work and when I was doing that work as well, that there's a lot of resistance toward understanding or opening ourselves up to those other forces of power that are so important to the community fabric.
Oh, I agree. As an epidemiologist, you'll appreciate this. It's all about the numbers and indicators and indices, and much stellar work has been done in that area. But so often, some of these voices and these perspectives are not captured in those. When I came back from Sierra Leone, I really felt that I needed to learn much more about qualitative methods and so on to try to bring those stories and that narrative, which is what you have to have in my judgment to really understand and make sense of the data. And the stories are just so powerful.
Yeah, I agree. I remember when I was doing my epidemiology degree, there was an actual divide in our class between the qualitative researchers and the quantitative researchers.
Yes.
Yeah. Is that true for you as well?
Oh, for sure. I think some of that's been overcome. I think as we have, we work much more in interdisciplinary teams right now. But a lot of those teams have some of the same issues we've just been talking about how to really hear each other and to open yourself up to the fact that numerical data is not everything, or for the qualitative researchers, stories are not everything. And again, I suppose it's about finding that sweet spot in between and bringing the strengths of both, or of however many disciplines you've got working together to try to address issues in a much more fulsome way.
Yes, the bridging of worlds.
Absolutely.
Oh, I love that. So the second to last, the penultimate question I would love to ask you is really around health inequities. That for me was a big theme, and it continues to be a big theme in the world. And I think health inequities can tell us a lot about societies and norms and maybe levels of dysfunction that go on in our communities. So in your experience, I mean, you've been in these situations where you've probably seen quite poignant, like strong indicators of health inequality or inequity. What is a pathway toward more health equity? What is it that you have learned about this on your journey?
I would say that it just takes many levels of change that one tries to synchronize, even though the synchronicity of it is often by chance as opposed to something that you can mastermind or plan for. When I lived in Sierra Leone, because I was a CUSO volunteer, a foreigner, our work was largely at the community level and trying to mobilize communities to expect and ask for change at higher levels. But really, it was Sierra Leoneans, as it should have been, who were guiding policy change and political change and so on. And we had some absolutely fabulous leaders in the country. The then person who was headed up the chief medical officer of health, and Dr. Victor Cole, who was the head of the paramedical school, and so on. These were visionary Sierra Leoneans who were driving that kind of change. Fran Baum, who is the sociologist at the University of Adelaide, talks about the nutcracker effect in health equity. And I love the visual. So she says, imagine that you've got a nutcracker, trying to open a hazelnut or whatever, but health equity is your nut. And you have to have the lever of the political will and the policy change, as well as the bottom part of the lever, which is mobilizing the community. And it's only when you can get those working together that you can crack that really tough nut of health equity. So I would say that's probably my biggest learning, but one just can't do it alone. It requires working across the system, working across disciplines, working across sectors, and first and foremost, working with the community to engage them and be engaged by them in what they see as priorities and what the change needs to be.
Because in that way, you're getting that buy-in, that the energy behind the change that is needed for that nutcracker. I love that
Yes,
analogy.
that's right. And it's the buy-in, but it's also that engagement is to make sure that we don't screw up.
Yes.
Because sometimes how we understand the problem, despite all of our evidence, despite all of our data and so on, can be really off kilter. And the community has a different understanding or a complementary understanding. And in my perspective, it's so important to get at those gold nuggets of learning and wisdom and know-how and generational knowledge that may point to dimensions of the problem that we just didn't get, we just didn't understand. But we must if we're going to seek solutions.
Yeah, and that goes back to, I think, an original comment you had about trusting the community knowledge.
Yes, indeed. Trusting and valuing, I would say,
yes,
they're both important.
I love that. That has been true for me in my work as well. So, it's been so affirming speaking with you. And I've been really just inspired by your journey, Nancy. I know you wanted to read some of your book, and that would be amazing. We do have this one question remaining, which is, what does being the change mean to you? So I'll let you, take us out in the way that you would like to. Yeah, whatever order works.
Okay. Well, thank you. It's been a delight to speak with you and to learn from you. So being the change, I would say it's really about starting with yourself. And as we've said, opening yourself up to other worldviews, that listening deeply, intently, with patience, and with a good dose of humility and a bit of humor thrown in makes for a magical mix. I think we have to keep questioning our assumptions. Even as a grandmother now, that's important. And recognize that we may be part of the problem. And I think efforts to decolonize global health and what seems to be finally moving at a greater speed in Canada, decolonization and reconciliation. I am part of the problem. So I finished off the book. It's in the last couple of pages, just talking about some advice for my younger self and also some advice for my young grandson. So I'll just read a little bit of that. And this is, of course, with the advantage of hindsight for my younger self. And I think this is the most important message of a number that I leave on that page. Feel the depths of human connections. Let these rouse your compassion, your humor, your love, your outrage, and your determination to better the human condition. I can't even say that without crying. And for my grandson, I say that the future rests on the shoulders of youth. So I have beginning advice for my grandson. Even the smallest and quietest voices matter. Join hands and lock arms to make things better. It takes many sleeps to change big things. Thank you.
Thank you. What beautiful and profound words to close our circle with. And I just want to express my gratitude to you and the work that you do and the path that you've chosen and the change that you've been able to enable through your courageous ways of being. It's a real inspiration and model for so many of us. So thank you so much, Nancy.
Thank you. It takes a village, There are many working on this. I'm just one.
Yes.
There's a few little stories.
Some great stories. Thank you.
Thanks a lot.
Hi, Changemaker. As promised, here are some of my takeaways from this nourishing and inspiring conversation with Nancy Edwards. The first was the phrase, "our problem, but not our solution." Wow. So many times we fail to fix problems by providing people and communities with solutions that are not from them. The resolution Nancy mentions speaks to the beautiful way of walking on two legs or walking in two worlds, providing a well-proven solution, in this case, a tetanus shot, and using community wisdom and worldview to give the community agency in how it's implemented. That requires us to let go of being right and to stop assuming solutions that work well in one culture will work well somewhere else. If you recognize that you're in a similar boat with saying, hey, this worked for me and therefore it should work for you, or hey, this works in the dominant white culture and therefore it should work in any other culture, or even, hey, this worked in this Indigenous community and therefore it will work in this other Indigenous community, can you stop and put down your wisdom and instead walk in with a beginner's mind with deep, deep curiosity? Another nugget that I loved was this idea of building trust. So often as outsiders, we think building trust is about the community trusting us. But to find solutions, to walk in two worlds, it goes both ways, meaning that we must trust and value community knowledge and experience. And I believe that we walk in with that from the very get-go. To uncover that community wisdom and the solutions that are there, Nancy reminds us that it requires listening to what is not being said and listening deeply to what is being said. So a question for you is there someone on your team that has that ability? Because not everyone does. That happens to be one of my superpowers, and it's one of the reasons I am an effective facilitator, because I'm able to pull to the surface what most people can't see or hear. The last nugget that I want to emphasize for you is the nutcracker effect. And Nancy spoke to this in the arena of health equity, that it requires a lever of political will and policy change. That's one handle, but on the other handle is mobilizing the community. Often we're only focused on one side or the other, depending on what role we're playing, which only ever results in tension and frustration. It also results in wasting resources on mediocre solutions to the wrong problems. As Nancy reminds us, it's so important to understand from the community what the problem is through their lens. And it's only then that we can work on the real solutions together. A great example of this is a health organization that I supported in Arizona. They had received funding to do diabetes education in a low-income neighborhood with higher than average diabetes rates. So the community workers began going door to door to implement surveys and create this program from the ground up, which is a really great approach. However, when they got there, all the community wanted to speak about was this new rezoning application that was underway in their community that put them all at risk of being displaced. So diabetes education was not their priority. Remaining in their homes, in their community was. So very wisely, this amazing organization and the funder allowed for the funds to be used for this project. And collectively, we worked on bringing community voices, concerns, and solutions into that rezoning decision-making process. So in that example, and in Nancy's example, I mean, we're really talking about community change. And if you're in that business, I encourage you to think about the problems that you're solving and who endorsed the problems. But this can also be applied in your relationships at home and at work. So what are the problems that you're busy trying to solve, and to whom are they a problem? It takes a lot of humility to ask yourself that question, but really thinking outside the box is essential if we truly want to make a difference. There are so many more nuggets, but I'm going to leave it there for now. If you want to dive deeper into Nancy's vast experience and wisdom, I recommend you go pick up a copy of her book, and there is a link to it in the show notes. All right, Changemaker, if you love what we're doing here, please consider becoming a Circle of Change supporter. You can make a one-time, monthly, or annual donation in whatever amount you like. I know that money is tight for many people right now, and it truly is a blessing that you would consider putting your dollars toward this change-making effort. If you are a current Circle of Change supporter, I appreciate you so, so much. And of course, you can support this show in so many ways by telling your friends about it and by leaving us a review on Apple Podcasts and giving us a 5-star rating. Thank you. I'll talk with you again next week on our final episode of the fall 2022 season of Circle of Change. Until then, know that I love you and I'm sending light your way, especially if you need it right now. Ciao. I'm now passing the talking piece to you. If you feel called to put your voice in the circle, please head to humconsulting.ca/podcast and share your story there. I cannot wait to hear what has come up for you as you have listened to what has been shared here today. I wish you love and joy beyond your wildest imagination. Thank you so much for being here in the Circle of Change. I also want to express my gratitude to the following peeps. Circle of Change is recorded on Lekwungen territories, and I am so grateful to live on this land. Our opening and closing music was created by the talented E-Roll Beats. You can find his creations at erollbeats.com. And special thanks to my coach, Mary Chan of Organized Sound Productions, for bringing this podcast to life. Until next time, ciao.